All right. Hello, everybody. Welcome to another masterclass. My name is Leticia, and today with me I have Dr. Niels Hart. He's a pathologist at Isala Hospital in the Netherlands. And today he's going to be presenting a study on interlaboratory HER2 variability and daily quality control across multiple Dutch labs. I invite you all to stay till the end of this lecture because there will be a chance to ask questions to Niels. So I encourage everyone to stay and engage at the end. I hope you enjoy this class. So let's get started.
Hello, I am Niels Hart, a pathologist in the Netherlands. I would like to thank the organizers for the opportunity to talk to you about a study concerning interlaboratory HER2 variability. Furthermore, I would like to address a new approach to a daily control of immunohistochemical stains. My disclosures: I am a pathologist at Isala, a general hospital at Zwolle, and that's in the center of the Netherlands. During this session, I would like to discuss our study concerning HER2 immunohistochemistry. We focused on HER2 low and showed the interlaboratory variability of the stain. I will address the use of calibrators and cell lines, what we learned from the study, and what we can do to improve. I'm also going to talk about AI-assisted quality controls, and I'll propose a testing algorithm that might be feasible in daily practice. The study we did focused on the performance of Dutch laboratories concerning HER2 analysis. We all know that we have been scoring HER2 for years now. However, we validated our test and are used to scoring in order to detect HER2 amplified breast carcinomas. The protocols we use are meant to find HER2 with a 3+ score. We designed the study to evaluate how our scoring performance looks like when we are using the same technique for a different goal. I considered it likely that scoring of HER2 low will be different compared to scoring to detect HER2 amplifications. 40 Dutch laboratories were invited to participate in our EQA-like study. We asked the labs to stain 3 blank slides on 3 consecutive days. We explained that we were looking for HER2 low and asked them to use their routine protocols for HER2 staining. The blank slides all contained a calibrator using microbeads to allow calculation of the lower limit of detection, use reference material that is standardized, and uses traceable units of measure. The calibrators have been addressed previously in this masterclass series. I nevertheless would like to explain them briefly again and show them to you, hoping it will help you to properly understand the study we did. So the calibrator is made with 15 spots containing 10 spots of coated glass beads ranging from 38,000 to 2.7 million copies of the HER2 protein. The exact concentration was measured using a fluorescent signal that is equivalent to the number of copies. 10 calibrated spots contained unfixed beads, 3 more spots contained formalin fixed controls, and 2 spots contained blank beads. The photo in the upper right corner shows you stained, unstained beads, and the smaller ones are the colored standard beads. The blank slides we shipped to the labs also contained a so-called dynamic range cell line. We included a cell line as we considered it to be informative to pathologists, as we are more used to looking at cells and tissue than we are used to looking at the microbeads. Furthermore, a cell line is more easily available and sometimes already in use in labs. We asked the participating laboratories to return their stained slides for central analysis. This slide shows you a schematic overview of the cell line. We used the cell line with 4 spots, containing a negative, weakly positive, intermediate positive, and a strongly staining cell line core. These cores represent a HER2 negative, HER2 1+, 2+, and 3+ tumor. Before we go to the results, I would like to walk you through some schematic drawings we consider to be relevant. First, I would like to show you a graph published by Tunison et al. This schematic view shows you the relevant and irrelevant areas in the sigmoid curve, showing epitope concentration and staining intensity. The epitope concentration on the x-axis and the staining intensity on the y-axis. A clearly negative or clearly positive case is not very informative when you are validating a new stain. The interesting area is the dynamic range in the sigmoid curve, marked with the green bar. This is the most informative area on the curve, the so-called critical samples. For example, if you use a TMA with several different tumor cores, it would be ideal if your TMA contains tumors showing staining patterns in this specific area of the curve. The right side of the slide shows you a similar schematic graph. We tried to include the calibrator and later the cell line. We know exactly where to draw the calibrator spots, the negative cell line core and the clearly positive cell line core. Unfortunately, we are not completely sure where to place the weak and the intermediate cell lines. Using this schematic representation of the slides, we consider this to be the dynamic range, and the cross represents the LOD. These three spots are the negative spots on the calibrator. Only a few are required to validate the immunohistochemical stain. The LOD is the spot where slightly positive samples are found. I considered it to be ideal if a calibrated spot is just above the LOD. Furthermore, it would be great if the weakly staining cell lines is just above the LOD as well. However, we are not completely sure where to position the second core of the cell line exactly. This is the most informative area, showing you the linear range. Most variation in HER2 is found here and corresponds to the intermediate core, the 2+ core. Finally, the plateau phase is reached. Again, just like the clearly negative spots, only a few samples are required for validation of an assay. This graph shows you the results concerning the lower limit of detection. 19 labs used the antibody 4B5, also called the pathway test. 6 labs used A0485, 5 labs used DG44 or the HER2 test, and 5 more labs used SP3. On the y-axis, the LOD, and please remember that the study showing a benefit for trastuzumab deruxtecan ADC treatment used 4B5 in combination with the ultraview detection method. When OptiView detection is used instead, the LOD is slightly lower, thus the test is becoming more sensitive. Variation for 4B5 with ultraview detection seems considerable. That is something that is known. The LOD of SP3 is quite high, and that one also shows a significant variability. I would like to briefly touch upon the analytical response curves. On the x-axis, the epitope concentration as a number that is equivalent to the fluorescent reference signal times 1000. On the y-axis, the measured staining intensity, and this graph shows you the 4B5 results. The next one DG44, and the last one is SP3. DG44 clearly reaches strong expression of HER2 early, and SP3 remains weakly positive for a longer time period. Please note that the fourth antibody, that is A0485, is not shown here. The calibrator results were inconclusive due to a strong background staining. The similar results were found in the cell lines. In these graphs, you can appreciate that the DG44 antibody is getting positive before 4B5. It was surprising to me that SP3 and A0485 showed a positive result for the negative core, rendering these antibodies less suitable for detection of HER2 low. These examples show you the 4 cores of the cell lines and how they look like. If you like, you can review the course yourself on the website I will show you during the discussion session. So, what does this mean for daily practice? We detected considerable interlaboratory variability for HER2, an issue that needs to be addressed. We should redo validations when a different clinical question is asked. HER2 measurement to detect amplification is a different question compared to HER2 low scoring. We also should check for predictive immunohistochemical stains for consistency over time. I did not show the data. We nevertheless measured the variability between 3 consecutive days as well, and that proved to be significant. I would like to suggest an algorithm for HER2 detection to simplify our daily routines. The idea is that we should try to imagine to which spot the stain results correspond on the previously shown curves. Doing so allows you to simplify interpretation. When can you be satisfied with the result, and when do you need to redo the staining? For example, if the control looks good and the tumor is clearly positive, you can go ahead and score the tumor. Also, if the control looks good and the tumor is negative, check the control using AI. If the results are within limits, you can continue scoring with or without AI-assisted scoring of the tumor. Measurement of the cell line in Qualitopix allows an exact measurement and allows calculation of the mean and cutoffs. So Qualitopix can be used as AI-assisted scoring of your cell line controls. Repetitive measurements makes it a lot easier to demonstrate stains that are outside its detection limits. Issues can be detected easily. Some issues were difficult to detect by eyeballing, nevertheless were found easily in Qualitopix. For example, on one day, using optic view detection, one slide showed a very strong signal. Another slide stained on the same day in the same machine, but stained with ultraview detection did not show that different expression level. The use of an online program is sometimes classified as a potential privacy hazard. I had to discuss that issue at our center as well. To overcome that issue, you need a service level agreement with the vendor of the online tool. It is now possible to use scans from a manual scanner instead of a box scanner that are normally used for digital pathology. This manual scanner is easy to use, cheap, and can be of value to overcome GDPR issues, or for labs that are not fully digitalized yet. In this graph, the differences between both scanners are shown for the cell lines. These results show slightly differences, meaning that it's not possible to use both a bulk scanner and a manual scanner for the same goal. You do need to make a choice between both. In conclusion, HER2 needs revalidation when you would like to use the test for detecting HER2 in amplified breast carcinomas as well as HER2 low. 4B5 and DG44 show consistent results, and the detection method used does matter. AI-assisted quality control can be very helpful to detect faulty machines or stains early. The use of an algorithm might help to choose wisely if you need to redo the stain or not. This algorithm can be very helpful to decrease the additional workload for your lab technicians. AI-assisted quality control is feasible with both automated bulk scanners as well as manual scanners. Thank you for your attention.
Hello, News. Thank you for this great presentation. I'm going to ask you to turn on your video camera now for us and your microphone so we can start the Q&A.
Yes,
Hello.
thank you very much. Hello.
Hello. Hi. So yeah, should we start with the questions first, Niels, or you want to share
Sure.
the cell lines and calibrators that you wanted to show? Up to you.
Maybe that's a good start. What I intended to do was to demonstrate some slides to show you the calibrators and to show the cell lines and the differences. You can appreciate them there a bit better than in a PowerPoint. This is the website I would like to use to demonstrate the slides. And here you can see the calibrator slides and below that the cell lines. Let's first start with the calibrators. I hope you can see them now.
Yes, we can see.
These are the 15 cores I talked about, and starting with the first one in the upper left corner, and then the last one at the right side. So if we have a look at the first one first, you can see the calibrators a bit better than on the photos. It's about the larger beads. So you have two beads in this slide, small ones, which are the color standards, and the larger ones. This is an unstained bead. And if we continue to follow to the next one, it's still not showing any staining here. When we arrive at the third bead, you can see there's slightly a slight difference compared to the negative ones. But then that becomes a bit more clear if we continue this path to the fourth one. And now you can see a few slides that are clearly positive. For example, this one and the other ones also show us a bit darker rim of the beads. The color standards remain the same, of course. So if we cross to the other side, there are the stronger staining beads. For example, this one, now you can clearly see that there's a positive signal. So going back to number 4, I think this is clearly a positive. You have to look for it, but it's about the LOD, so the lower level of detection. But if we go back to the third one, I think it's still a bit present here. For example, that bead. So you are somewhere at spot 3 that you can see the staining appearing a bit. So this is in fact used to draw the sigmoid curves that I showed in the presentation. So we have an additional one. This is a clearly negative one. This is a negative as well. And these 3 in the middle are color standards as well. Not really a calibrator, but more like a control, which you can use for a daily practice, since it's well, a reference to the calibrator, but not showing a gradual increase in staining intensity. It's just a bit more clear than the calibrator itself. So that's about the calibrator. And when we now switch to the cell lines, for example, this one, they were on the same glass. This is a clearly positive, of course. And then we have the 2 in the middle that are a bit more difficult. It's still clearly positive. What you can see is decreasing in intensity. And then the last one is the negative one. So if you keep this in mind, especially this score or the third one, then we can switch from the staining of 4B5 cells to the DG44. That's this slide. You can now see that it is a bit stronger compared to 4B5. So the probably expected LOD is a bit lower as well. And that's exactly what we found. So these kind of cell lines and beads were measured exactly using digital pathology. And the cell lines were used in Qualitopix, and that figures and that percentages that you can get back from Qualitopix are used for the study. All right, so now everyone had a chance to review the calibrators and the cell lines. Maybe there are some questions.
Yes, thank you. Thank you for sharing this news. We have one question from Mass. Well, first of all, he's saying thank you for the interesting talk. And he wanted to hear, how can you ensure that cell lines express the same levels of antigen over time?
Well, that's an interesting one. Thank you for your question. You really cannot make sure that it's exactly the same. That is what you assume, right? So what you do, in fact, in your daily practice is repeated measurements. So you measure your cell line not just once, but I would suggest at least 20 times. Then use Qualitopix to measure exactly where your levels are during that 20 or during that period you measured those 20 slides. So if you plot that in a graph, and that's the so-called Levi-Jennings graph, you can see exactly the differences over time. And that's the interesting part. So if you have those 20 results, you can draw the mean from your results and the standard deviation and use that to as some kind of calibration for that specific marker. And the next step would be maybe a few days later, if you do the stain again, that you check your result compared to the previous result and check if you are still in the right limits of your detection, on a limit of detection for that specific marker. That's the idea. And my experience is that cell lines look quite good and quite stable. Sometimes had the question if it's still correct, and I changed it using another cell block and discussed it a bit with the vendor of the cell lines. But well, they always prove to be quite stable. Also, if you use them after you store them a while in the freezer or on your, well, maybe even on the desk, it's still showing quite a good result. So that's how we work with the cell lines.
All right, thank you. We have a question from Bettina. She's asking, how does Qualitopix help you to decide which stains should be repeated?
Yeah, that's about the same. So you first start measuring those 20 initial samples. And if you are happy with those samples, you can call them, okay, this is my gold standard. I did that gold standard for 20 times, calculated the mean and the standard deviation. And that's the setting of that specific marker in your lab. Each lab should do that for themselves. So there's always a bit of a difference between labs and also between days. So it's not an exact number that you are going to get. It's an estimate for that specific day. As long as it's between limits, it's probably going to be fine. So of course, we tested that and used some slides that are not correctly stained. So with another antibody dilution or with another thickness of the slide itself, and then you quite rapidly see it changing. So slide changes can be detected in this way, but you have to calibrate your Qualitopix setting first, of course.
Okay, cool. And you mentioned on the conclusions that by using AI, or in this case, Qualitopix, it helps to decrease the workload in the lab. Could you elaborate a little bit on that?
Yeah. Well, it's always getting more work, of course, if you have to do it that way. And I was looking for a way how to diminish that workload for your lab technicians. So they already have a lot of work to do. So are you going to do it yourself? Well, you're probably busy as well. So what to do then? Well, I found it quite time consuming to scan the slides with our routine scanner, download the slide and upload it again to Qualitopix. Yeah, of course you get a fine result, but then it's taking quite some time and sometimes miss scans. So I was looking for other methods, other scanners to find out if that might be a bit easier. Well, last summer I was at the ECP meeting in Dublin and found another tool that I found very promising. Maybe I could show you that. Is that okay?
Yeah, yeah.
Yeah. All right, so I show you a little video. It's a Loom video, and I'm using a so-called manual scanner. You saw a slide in the presentation about that. I just let it run and talk a bit meanwhile. So this scanner, I'm now scanning the cell lines. Obviously, I'm starting with the strongly staining cell line, and you can see a little grid. There's a circle on that, and the idea is to use that grid to capture the slide image. And I'm now recording the tissue and make it well some kind of a whole slide image. Now, skipping to the next one, it's also the idea to find the circle and display the tissue in exactly that circle. Then continue further to the third core of the cell line. Record that as well. That's what's happening now. Sometimes it's not really in focus, so you can adjust it a bit or go back in the slide and do a second recording, and that's all done during this process. So now you can see that I'm almost finished scanning the 4 cores, and that's it. It doesn't take a lot of time. It's done now, in fact. So using this this scan, in fact, it's a whole slide scan, but just skipping the blank parts of the slide. That was good enough to use for Qualitopix. So I made the scan, uploaded that to Qualitopix, and well, it's a small file in fact, so it doesn't take that long. And waited for the result before you continue scoring the slide. So you don't need to go to the scanner; you do it yourself on the microscope, and well, it proved to be quite easy. So I'm quite happy with that improvement, and it works. It's maybe surprising, but it does work.
Very nice. Thank you for sharing. We just got another question. Let me see. What are the most important stains to check for consistency? Are all IHC stains important, or are there some that are more sensitive to low, high variability like HER2?
All right. Yes, that's an interesting one. I've been thinking about that as well. And the idea behind this is sometimes we use stains in a panel, right? So we don't just look at one stain, we use a panel of stains, probably containing positive of expected to be positive stains or negative stains, all in the same panel. So if you are working in a panel-like setting to determine a diagnosis, I don't think you should or you need to do this. You can obviously, but it's not really needed, since if one slide is off and not correctly stained, you will still detect the right and the right amount of stain that you require. If a strong positive stain is expected, it's weakly positive, it's still positive, so who cares? In fact, it's getting more important if you use just one stain. For example, if you use a stain to determine if a patient is eligible for a specific treatment choice, and then you don't have the control with the other stains. It's just that one slide that you need to score. So that's the one I find to be important. So if you would like to score HER2, or if you would like to score PD-L1, for example, those are just single stains used for just one goal, and that's the treatment decision. So that are the stains that I would like to advocate to use in a system like this. And well, to be fair, not a lot of stains need to be scored exactly in systems like the Qualitopix tool. So that's the algorithm I showed. So some of them are clearly positive, so you might not need to scan those and upload those slides. It's just about the ones that are negative or possibly around the cutoff that is clinically relevant. So if you just use those to scan them, check the controls exactly, and then use AI to measure the tissue, that's probably good enough.
Cool. Thank you. Henrik is asking, you used both cell lines and beads in your study and have shown a correlation between the material. How do you see yourself using these materials in the future? Will you use them both?
Not sure yet if I'm going to use both. I will probably continue using the calibrator first, just to make sure that the tissue and or the stain is exactly right and exactly stained correctly. And that's the first step. But it's a very cumbersome tool to use for everyday diagnostics. You cannot use a calibrator and calculate your LOD for that specific day again and again. So you do that once, and then you switch to maybe not the use of a calibrator, but of the control beads. And when you choose a control bead, for example, that is quite near your LOD. So for example, in the one I showed you before, spot 3 was slightly staining, and spot 4 was a bit more clear compared to spot 3. So one of those, you can use that one for your daily practice. If that bead is slightly staining in the case you would like to score, then you're probably safe and you can continue. The other thing is cell lines are quite useful as well. So if you used that, maybe ask your technicians or do it yourself like I showed you before. Then you have also a good idea if you are in the right area with the stain intensity. So those two would be important. The bead controls with just one spot, or the cell lines. Well, maybe one of them that you prefer, but I would advocate to start with the calibrators, just making sure that you are in the right area with the lower level of detection.
Cool.
Okay.
Thank you. I think that's it for today. We don't have more questions, but I wanna say thank you, Niels, for the very interesting presentation, and very nice of you to, share your screen and show different things. I think it's always interesting to see different stuff. So yeah, thank you. And very interesting study as well with Qualitopix. So
thank you very much. Okay. Well,
yes, thank you for coming. And yeah, see you. Just everyone, also I want to say thank you for joining the masterclass. Thanks, Niels. Thanks, everybody. Bye.
Bye-bye.